If you can please tell
Yes.
us, how did you first get started with the Cellsonic?
I saw it on internet. I was looking for new opportunities because I had a long working history in the big pharma area, and I was looking for new opportunities. And I can't explain you how, but suddenly this showed up, and I was watching it, and I said, "Oh, this is looking too good to be true." So I was sending a mail to the sales Cellsonic, and Endo
Yeah.
he answered very fast. He answered, and he said, "Do you want to talk to me?" And I said, "Yes, I would like to see who is behind all this. So if it's not something really odd thing, so I want to talk to him." And I called him, and I think it was a Saturday night. I was sitting with a beer or a cake or something in my home, and I called him quite late at 9 o'clock in the evening, I think. And then we started the whole communication about this and I was sent a lot of information about biophysics,
Oh,
what it
yes.
was, and I started to read about it and research about it, and I really tried to get down to the bottom of what is how does this work and how is all this electrical
Right.
potential, what is all that about. So
And
yeah, that's how it started.
was it too good or was it true? Did it turn out to be true as well?
Yeah, but then I want to have some experience with it. So first I had all the theoretical things about it, and I thought, okay, I have understand this, but how does it work in real life?
Right.
So and that's how I said to Andrew, but I want to have some experience with this in real life, and I found some sick people who would like to get treated, and brought them to Poland, where there was a Cellsonic clinic, and then we were treating those clients, and there were all kind of issues they came
Oh,
with.
okay.
So that's how I
Well,
suddenly started myself to treat clients and got it sort of into my own hands.
okay. All right. Great. If we can
So,
quickly, sorry, you want to say something?
no, it's
Okay.
fine.
If we can move on to two of your favorite success stories when it comes to maybe like something about a paralysis. I think you recently helped a man with paralysis. There was a video where there was a man who was getting up from his wheelchair, who was able to walk, who wasn't able
Yeah.
to walk when he came to you, but he was able to go back home walking in just one session. So
No,
if
no, no. No, he was not. He was not. He was not ready to walk after one session. He was sitting in a wheelchair. He had been sitting there for 14 years
okay,
after a blood clot in the brain, and he's still getting treatment. So he's coming now and then, and he's improving in his hands, and his legs is more powerful. But he's not able to walk completely without
okay,
any sticks or anything. But
all
he
right,
is improving. And the first thing that was improving, that was very strange. That was that he said to me, "Now I can read the subtitles on the
oh
text TV," and he has not been able to read that before. So that was really strange that his
yeah,
brain after the treatment was able to read. So that was a big improvement for him. Um, yeah, and then what have I had all kind of disease through this clinic for the past 2 years, I would say. A lot of arthritis, a lot of people with pain, arthritis in the thumbs and the knees and the shoulders. A lot of hard working men who has been working tough men, and they are also very painful everywhere. And that's true that they after 2 and 3 treatments are back to work when they have not been able to
oh
work because they're in so much pain. So
okay.
it's very effective on pain and arthritis and fibromyalgia and all that kind of things in very
Right.
few treatments. 2 and 3 treatments can make a whole difference to a person's life.
Wow, wow. And
Yeah.
can you tell us for the audience two or three treatments? So how many do you have a set protocol for one treatment? A number of pulses?
No, because what I'm doing, I'm making what I call a full body treatment. So first I sort of ask the client what the disease are and what they have been examined through hospitals from radiation and x-rays and all that. And then I know sort of where to start
Right.
with this client. And then it's very important that we also mention about how did they start this treatment. Were they did they have any stress or did they have any trauma or things like that? And most of the times people can tell, I think I got sick because this and this happened to me for 20 years ago. So it's very important while we are treating, we also talk to the people how to get rid of stress. Because if you keep staying in the stress, you use the immune system, and then it will all
Right.
the voltage of the cells will go down again. So it is a fantastic machine, but we also have to remember it's a holistic treatment we are offering people. So they have to be aware about the stress and all those things they are, yeah, what they mean in life. Yeah, what did you ask about? I forgot already.
No, we were talking about how many pulses did you register to deliver to this
Oh
gentleman?
yeah,
Yeah.
yeah. Because then I make this whole body treatment when I have sort of have this long talk with people, and I put them in, and I often I measure with pendulum because the pendulum can tell me where the energy level is
Yeah.
low, and then I optimize all those places. So it's very individual how many places I'm treat and where I'm treating, and I all the time I'm checking the immune system, which is on the spinal cord, and it's the vagus nerve I'm treating here, and I'm treating the liver and the kidney and the pancreas and all those very essential organs. I'm always checking, and I have also very got the results on the lung disease, like chronic obstructive lung disease. I'm treating the whole lung system, and also because Salsonic is very effective on bacterial.
Yeah.
So if they have some kind of infection, it'll take it very fast.
Yeah, that is true.
Another issue is the scar. The scar tissue is a very important thing in all those treatments because the scar is blocking the energy in the whole body. So if you have scar in the lungs after many infections, or if you have a scar all across your stomach or something, I always treat with Salsonic because it loosens up so the energy can flow through the body. Many people have a lot of scars. Women have from pregnant or pregnancy after delivering and things like that. So it's very important that we loosen up all the scars tissues as well.
Okay, that I had never heard of that before, so thank you for that. Have you treated somebody with varicose veins? Have you heard of varicose veins?
Varicose veins.
Yeah.
Yeah, with on the bones, on the legs. I
Yes,
mean,
yes.
yeah. I have quite a lot of people with all kind of leg problems, like neuropathia in the legs and swollen legs and all that. And I'm treating the whole back up and down the legs. I also have people who have always cold feet, and they can't touch when they touch the ground. They can't feel the ground.
Oh.
So you have to treat the whole back and under the feet as well. So this is also a part of it. Yes.
All right. Can you walk us through a typical session once a patient enters your clinic? How things go down, your process?
Yes, but that's a bit like I said before, that I start to have a long communication about when do they get ill, what happened through their life when they get ill, and what are the symptoms, and what diagnosis do they have, what do the doctors tell about it, and what kind of medicine do they get now, especially all the painkiller. People are in a lot of painkilling. So we sort of measure the pain relief. I ask them, how much pain do you have now from 1 to 10, and after the treatment, what is it now? And then I always tell the client, if you want to try and stop some of those painkillers, you can talk to your doctor about it, because they will very easily get a relief from pain.
Right.
So a long good talk with the patient first, and then I take them in and I use the pendulum and I think about what kind of disease is this, so where is it important to aim with the shock heads.
All right.
And then I mostly tell people to come once every week in 3 weeks, and then after 3 times we make an evaluation. How is it now? And then we can extend the next treatment to maybe 2 weeks, and then we can extend it to 1 time a month. So I'm sort of dropping people out afterwards. And then I have many clients who come here maybe one every second month or something like that, and they feel I now need another treatment, or they have something new that happened to them. So